Okay, for chapter 13, revision for the chapter, just focusing on the core of the chapter. What's more important than what? You need to study everything, but you need to focus on the more important stuff. Okay, what are the enlargements? And why do we have enlargements? The spinal cord is not symmetrical. It doesn't go like this. There are some enlargements. Why? And what are the types of enlargements? Why do we have each one of those? Important. Conus medullaris, filum terminale, coda equina. Important to know why do we have, or what is each one of those. Numbers are important, of course, for lecture and lab, both of them. Roots, and is it sensory or motor, is important. Ventral root versus the dorsal root and the ganglia. In the spinal nerve itself, we have a ventral root that carry motor or sensory? Ventral?
Motor and sensory? Oh, motor.
Motor. And the dorsal?
Sensory.
How about the spinal nerve itself? Both. Yeah, you have a root, sensory, another root that's motor, and then both of them will go together. So obviously the spinal nerves are mixed. You carry both of them. And this is not the case when you go to the cranial nerves. It's not. Some neurons, some nerves in the cranial nerve are sensory only, and some others are motor only, and some others are mixed. How about the spinal nerves? All of them are mixed. Spinal meninges are important, and the spaces in between, very important. Why do we have pia, arachnoid, dura? The arrangement, the importance of each one of those, and more importantly, the spaces. Clear? The meninges and the spaces in between these meninges, important. Very important. Why do we have denticulate ligament? Important. Where is the location of the blood vessels? Along which meninges? Pia. Important. What's the difference between white matter and gray matter? Which one is outside and which one is inside? In the spinal cord, which one is inside? Gray or white?
Gray.
Gray is inside and the white is outside. And what's white?
Myelinated.
Myelinated only?
Yes.
No. It's mixed, but more myelinated. It's not perfectly white. We mentioned that before. White doesn't mean perfectly white. White means mainly white. So we have myelinated and unmyelinated, but more myelinated, making it looks like white. Okay? It's not pure myelinated. It's not pure white. So the white matter is mix, but more myelinated. The gray is unmyelinated, plus cell bodies and neuroglia. Okay? Okay, nuclei. I think I mentioned that several times. The difference between ganglia and nucleus. And the type of nucleus. What type of nuclei do we have in the dorsal root? Sensory. What kind of nuclei do we have in the ventral? What kind of nuclei do we have in the lateral? Both, but belong to somatic or autonomic? No, you don't forget this. Look at this. Do you remember this?
Yes.
The nuclei here are, this is dorsal. What type of nuclei?
Sensory.
Sensory what?
Sensory cells.
Somatic or autonomic? Somatic. And this is
Autonomic.
sensory or motor?
Motor.
Motor, autonomic or somatic?
Motor.
Somatic. Sensory, somatic. Motor, somatic. Here you have two. Sensory and motor, what? Autonomic. Okay, you can have this, you can draw it. You have to remember this. Sensory nuclei, sensory somatic in the dorsal, sensory somatic in the dorsal, motor somatic in the ventral, sensory and motor autonomic in the lateral. This figure, okay, this is important. Okay, what is located in each one of those columns? Anterior, posterior, and lateral. So, what is inside the three horns? What is inside the three columns? This is important. Okay. The connective tissue covering, you have to differentiate between those three. Endo, peri, epi. Okay? So this is obviously important. Like this picture will show you what you need to know. White ramus versus gray ramus. And ventral ramus versus dorsal ramus. So you need to know the rami. And what's the difference? Which ramus is larger, the ventral or the dorsal ramus? Think about it. Ventral or dorsal? What's the ventral feeding? Front and side. What's the dorsal feeding? The back only. So which one is larger? Ventral is larger. The back is only feeding the muscles of the back, just a couple of nerves, few nerves. Okay, but in the front, there are a lot of structures. It's front and lateral. So ventral is obviously larger. Okay, dorsal versus ventral. The ventral is larger. Okay. What dermatome means? Okay. No details. Just understand what the dermatome. What is this? Shingles. So important. What's the shingles? Viruses located within what? I talked about this. Where does these viruses live in? Yes? Neuroglia. They live in the neuroglia. They go to the neurons. They go to the neuroglia. Stay there. When your immunity goes down, it travels back and go to the area of the skin supplied by this neuron. Remember this? Goes like this. This is a nerve. This is a nerve. This is a receptor. So the virus invades you, go through the nerve, go to the ganglia, and stay here. Your immunity goes down. It will travel back and go to the feature of the skin that is supplied by this and start to show you these shingles. Did you understand this? Remember this, okay? Shingles. This basically herpes. This is how herpes work. They invade you, they go to the nerve, travel to the ganglia, stay there. They don't do anything. Except when your immunity goes down, they travel the opposite way and go to the skin that is supplied by the neuron that's infected, okay? Plexuses, extremely important, lecture and lab, okay? Especially, where do we start? Do you remember these numbers that we talked about? I summarize it here. Okay? 1551, 12,444. Can you remember this?
Yes.
This is how each one of those start. C1 to C5, C5 to T1, T12 to L4, and L4 to S4. These are the four plexuses. And I told you what to know about each one of those. There is a nerve that you need to know about each one of these. Cervical plexus. Can we mute the phone that's making the noise? Cervical nerve, which nerve? The cervical plexus, which nerve? Come from this that we need to know? Phrenic, which feet? Phrenic, diaphragm, phrenic, diaphragm. Lumbar, which nerve? Femoral, sacral, sciatic, brachial. You have to know all the nerves. Okay? I think we covered that before. Yes, I will show you. Here are the branches. Musculoskeletal, median, ulnar, axillary, radial. So 5 out of the brachial. Other 3, just 1. Pair plexus. Okay, this is what we did today. What's the difference between sensory motor and neuron, which is the reflex arc? The arrangement is important to know divergence versus convergence versus serial processing versus parallel versus reverbation. We need to know this. Different types of reflexes and how they work is important. Examples: stretch reflex, function, and is it mono or polysynaptic? It's mono, and what's the function? Prevent overstretching. This is for the stretch reflex. And then the flexor reflex, which is this one, is it mono or poly? Poly. Okay, and what's the function? Coordination, this is why we have poly, but the function is to move away. Flex, move away from the painful stimulus. These types are important also. What's the difference? Is it innate or acquired? What's the example for innate that we give?
Birth, when you're born with it?
No, it starts with B. The one that we said it's normal in infant, Babinski, yes. So the innate one is like Babinski. So Babinski, any newborn will have it. Okay, do you have it?
No.
No, if you have it, it's a brain damage. There is a problem with the brain. You don't have it. It's only in infants. It's normal in infants, so it's innate. Acquired reflex is anything. Like walking. Can an infant walk? No, because it's an acquired reflex. It needs coordination. The other thing is motor response. Does your skeletal muscles respond or your visceral effector response? So somatic versus visceral. Is it monosynaptic and polysynaptic, and what's the difference? We cover that. In monosynaptic, how many interneurons do you have?
None.
Nothing, 0. Polysynaptic, how many interneuron? One or more. Okay, if you come from the spinal cord, spinal reflex, brain, you call it the cranial. Can be intersegmental, mono, poly, intersegmental. This is an example of the mono, which is a stretch reflex, and what's the function we know. Muscle spindle. It's important to remember that these are the receptors for stretch reflex. Muscle spindles. The posterior reflex, which is used as stretch reflex. Polysynaptic is using both EPSPs and IPSPs. Tendon jerk or tendon reflex. Flexor reflex. Flexor reflex, we talked about this. Is it poly or monosynaptic?
Poly.
Polysynaptic. Reciprocal inhibition, we talked about this, which is important also. Ipsilateral versus contralateral or crossed. Just understand the difference. Characteristics of polysynaptic reflex: many neurons, a pool. It's intersegmental, reciprocal inhibition, reverberating, and several reflexes. This is important to know also. Babinetsky, it's normal in infants. In adults, it means
Brain damage.
brain damage or CNS damage. Okay, that's it.